Hello, everyone. Welcome to BioNexus Health Podcast series. Today, it's not necessarily just for autism. This is a group meeting today that we'll be having with different parents, patients, individuals that have any questions regarding Herxheimer, Jarisch Herxheimer reactions or die-off reactions. I have a video out already on die-off reaction. It's an educational, informative video as to what die-off is, what can be done in case you or your child is experiencing die-off reactions. However, there still seem to be several more questions, and queries that need clearing up. So here we go. I shall be welcoming whoever has decided to attend today. And I hope this proves to be additionally informative for those watching.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
All right, good. Welcome, everyone. So today we will be speaking about die-off reactions. And as you're all aware, I do have one video out there already that explains what die-off is. But I found that many people have additional questions, so I'm happy to answer them one by one, though. So who shall we begin with? Who is, okay, here we go. Laura wants to come in. Let me admit her. Right. Sudhi, you want to go? You have a question for me?
Go ahead to service first.
Sorry?
Go ahead to service first.
Okay, so you don't have a question. I'm sorry, I didn't understand.
I have one question.
Okay, go ahead.
Is the die-off started right away after we have a supplement, or it takes like maybe 4 hours after medication?
Okay. Well, excellent question. So when you say medication, right, you mean antimicrobial?
Yeah.
Okay. So antimicrobial, just like the name suggests, right, it kills microbes, meaning it kills yeast, bacteria, viruses, parasites. So die-off reaction can only happen when something is dying off, correct?
Yep.
All right. So when you reach the antimicrobial section of your protocol, that's when you will see die-off reactions. Now, when do they happen? Okay. It's usually within a couple hours. So, if you take the herbal cocktail, you've added a new antimicrobial, even if it's one drop, if you've added something new, antimicrobial, or if you have increased the drops of the antimicrobial, right? So, you have a child or you yourself were doing fine with one drop, everything was okay. But then when you add in 2 drops, within a couple hours, you see die-off reaction. So that can happen. It's usually pretty quickly, right? You will not see a die-off reaction after 2 days, 3 days. That's not a die-off reaction. That could be, environmental exposure, because many people are still living in compromised environments, with mold toxins or any other triggers which could be in the environment, right? Like volatile organic compounds, or, if you recently got new furniture, new car. So all of these exposures, once again, I have a full lecture on exposures as well on the YouTube channel. So if there is any continuing exposure, if you haven't had time to clean up your space, then that could be the reasons for some ups and downs that you see. But die-off reaction usually happens within a couple hours.
So what is the top sign of the die-off reaction?
Okay, so there is no there are no symptoms which are applicable to everyone, right? Because everyone has their own set of infections. Not everybody has the same problem. Like even if the diagnosis, for example, is Lyme disease, or even if, I'm sorry, hold on. Mal, can you please turn off your audio? Thank you. So even if the diagnosis is autism or PANDAS or Lyme disease or mold exposure, that everyone's symptoms are different. So your die-off reaction is going to depend on your symptoms. So sorry, what's that?
Your what depends what are you seeking for?
Correct. So if you have a child whose symptoms already are hyperactivity, right, difficulty with focus, any kind of pain in the body or headache, any kind of joint pain. I mean, again, I said child, but it could be all age groups, right? Die-off reaction applies to all age groups. So whatever your symptoms are, they are caused by your bacteria, viruses, etc., correct, in your body. So when these are dying off, the symptoms that are caused by these bacteria, viruses, fungi, mold, etc., when they are dying off, those are the symptoms that get worse. So it is all individual. Whatever symptoms you have, those you will see get worse during the die-off reaction. Make sense? Okay, good. What's the next question?
Can you hear me, Dr. Dashore?
Who is this?
This is Becky. But my question is, when I started using the drops back in March, this is before we saw you. Yes, and what had happened, he seemed to tolerate the drops very well. I think it was the NSB1. I believe that's it. And that's the one that Karen starts you with, to detox mold and whatever's going on. And he did fine. He just had trouble sleeping. And then that's when he went into some seizures because he had trouble sleeping. And I wondered, what do you suggest for that? And what do you suggest for sleeping? He's been using melatonin for years, and it doesn't even seem like that even really works as well anymore.
I see. Well, Becky, this is not a die-off question.
Okay.
So I think you're a little bit confused. This is not a die-off question. How to treat seizures, I can answer that at your next consultation. But, from what I'm hearing, he actually responded well to the BioNexus herbals. So that's great. But if he's...
I guess I thought that it might cause the die-off reaction was, the seizure was
Oh,
from...
no, absolutely not.
Okay. I apologize because I know we're on topic here and that's what I'm trying to be, but that's what I thought. I thought, well, did that cause it? Because he hadn't had one for like 6 months. And I thought, well, that must have triggered it because of die-off.
When did the seizure start?
Back in March, he had like 3.
No.
Yes.
When was the first time he had a seizure?
When he started going into puberty, about 16.
Right. Yes, that is, that would be a great question for the endocrinologist.
Okay.
As well as the neurologist, because it's got nothing to do. I mean, that's just, it is a huge problem when there is mold exposure, when the brain is inflamed and you haven't received adequate treatment for that. right? So please don't lump everything under die-off, because then you will not be getting the proper care that you need. Remember what I said about die-off. The existing symptoms get worse. If you are seeing new symptoms,
Yeah.
that means that there is something else going on and it needs to be addressed. Make sense, right? So once again, die-off reaction is the bacteria, viruses, all different, microorganisms in your body that showed up in the labs. The protocol is customized to that. And when you start killing those off with the antimicrobial herbals, the existing symptoms may exacerbate, or the existing symptoms may get worse. Okay. If you see any new symptoms, that is absolutely unrelated to die-off. Okay. So please get proper care and advice for your child. If you're seeing, don't lump, I have mentioned this in my die-off webinar as well, that please don't lump everything under die-off. I've had parents call me. One example I'll give you, and it happened during COVID, right?
Right.
When you have someone doing herbals and doing well, making great improvements, and then suddenly, you send me an email, a message saying that, little Johnny is having nausea. He's having, nose is running. He has a little bit of a cough, doesn't have an appetite. Yesterday, he vomited a couple times, so I'm going to hold off on herbals. And I'm like, you know what? This sounds classic, like a stomach bug or COVID.
Yeah.
So, please don't sweep it under the rug that everything is die-off reaction, because, you might miss something important for yourself or your child. So please be careful with that.
Right. I understand. Yep. Makes sense.
Good. Thank you. Good. All right. Who is next? Any other questions?
I'd like to ask a question.
Linda. Yes. Hi.
Thank you. You're very familiar with my case with Connor. He's very sensitive, probably one of the most sensitive patients you've had so far. And when I'm wondering, I know you had mentioned that maybe if the antimicrobials, when we get to that point, he's got Mast Cell Activation Syndrome, as I said, and he gets a histamine storm when he goes through a Herx kind of reaction. And so he gets headaches, jaw pain, and ear pain primarily. And if I wanted to go, you had mentioned that maybe you can do the herbals. If one drop is too much, you can put it on the skin, maybe under the feet, as a possibility to lower the symptoms. I'm wondering, one, is that effective at all? And two, would that make the infections more resistant to the herbals by having a low dose like that?
Infections don't become resistant to herbals because all herbals have a full bouquet of active compounds, right? Resistance is usually, there are very, very few patients who don't respond to herbals. That's fine. Starting with one drop on the skin is okay to begin with, but that cannot go on for weeks and months. That's typically, in the beginning, you do one drop on the skin and then try. Now, if a child, as I mentioned to you, like we discussed, I think we actually, because the reaction is so severe, we kind of go around in circles. Sorry, hold on one second. Actually, Rafiq, if you have a question, you will have to speak the question. I won't have time to look at the chat and answer the questions. Okay, so please speak your question so we can have a discussion for everyone. All right, Linda, back to you. Yes. So we are, I think, going around in circles a little bit. I think the best approach for you guys would be to first address the severe mast cell issues. Okay, and then at the same time, if a child is having extremely severe reactions to herbals, that child is probably not suited for for an herbal protocol. I've had that happen with a few, very few over the years, but that's, quite possible, because sometimes the mast cell activation and what's the other thing that happens with prolonged mold exposure, some children have mold exposure starting, during pregnancy in utero. So that kind of, becomes quite deeply impacted intracellular. So mast cell activation and multiple chemical sensitivities do develop after prolonged exposure, and multiple triggers, which we saw in the labs. There are a lot of issues going on with this little one. So at that time, herbals can be one of the substances that the person reacts to, even though it's good. The healthiest of foods, like I recently had a patient, she said, her mast cell is not allowing her to take anything with curcumin. So how do you bring inflammation down naturally? Curcumin is a huge component. And in my life, I've never heard of anyone allergic to turmeric. So that was my first, one always learns as you interact with so many different people around the world. So we are trying to come up with an alternative for her. But yes, even though it says multiple chemical sensitivities, the word chemical doesn't always mean like, chemicals. It could mean like, it should actually be multiple substance sensitivities. So that's what happens. And if you keep trying for a few weeks and you can't even build up to one drop, it would be best to deal with the mast cell. Now, there are herbals for mast cell for people who respond less severely, right? There are supplements, there are homeopathics, German biologicals, which can be used for mast cell. But sometimes, you need like major treatment, like, ketotifen, or like, what's the other one? Sorry, I can't remember the conventional treatments now, but yes, actually it came back. Cromolyn, sodium, etc. So there are a few things that are conventionally used for, extremely severe reactivity like Connor has. So it would be best to just, take a huge step back from the BioNexus protocol and get that treated first, calm the inflammation down.
Yeah, it's funny, he doesn't respond, have any issues with supplements except for vitamin C in high doses. But you're right, with any kind of die-off like herbal or glutathione or anything that kills off the infections, he has a histamine storm. So I have identified, I went to a Mast Cell Activation Syndrome summit and found some good doctors, and one of them's in my area.
Oh, okay.
I'm really excited, and I have a discovery call with them this week. So I'm hoping to get that on their calendar ASAP, and then get the mast cells treated so that we can get on your protocol as soon as possible.
Yes,
So
yes. That's great. Now, please don't mix protocols. If you cannot do the entire BioNexus protocol, it's best to stop everything and just transition to the mast cell doctor's protocol, right? Because even if conventional, I remember way back in the day trying ketotifen, trying I don't think we tried cromolyn, but there were other supplements which were conventional, which we tried for a little while, and it seemed to resolve like relatively quickly, the cytokine storm. And once that resolved, and we were always able to continue the herbals, but we just had to lower the drops. Brian didn't have like monumental reactions like Connor does.
Okay, gotcha. And just so you know, the rest of our family doesn't have a mast cell activation syndrome issue. He's He's from a donor egg, so he just has a different genetic makeup than the rest of us. So I think the rest of our family will probably stay on the protocol or get on the protocol with you, which would be great.
All
Thank you.
right. Oh, you're welcome. You're welcome. Who has the next question?
Join us next week for part 2. Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, Mast Cell Activation Syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.